Hey guys, Dr. Casey Schneibel, and welcome back to Movement Every Day, Episode 7. Today I want to talk a little bit about bony anatomy within the skeleton. I'm a real visual guy. I'm not sure if this is going to help you, but I know it would help me. I'm just going to show you certain areas of the body that a lot of chiropractors work on, and that way you can get a better understanding of the joints that we work on, okay? I'm going to kind of just hit a couple areas of the body and we'll go from there. I'm going to first start off here with the spine here. I have two models, and by the way, this is Dr. Bones here, so say hello to Dr. Bones. But I'm going to start off with the neck, okay? The neck is actually consistent of 7 vertebral bones, okay? 1, 2, 3, 4, 5, 6, 7. And the vertebral bones are actually separated by these little soft structures called the discs, okay? The discs are consistent of a tough outer layer called the annulus fibrosus, and then a very softer inner layer called the nucleus pulposus, okay? The point of the disc is to act as a shock absorber between the two vertebrae, okay? If we kind of rotate the spine to the side of the neck, we can see these yellow structures, and those are the nerves that are coming out from the spinal cord, okay? Those are very important structures because when those are either pinched or irritated due to inflammation, or say we have a disc herniation, which I'll show you in the lumbar spine, we can cause pinching or irritation on those nerves, and that can cause pain as well, okay? I'm just going to rotate the back of the spine so you kind of see what the back of the spine looks like. As chiropractors, this is our home, okay? We like to palpate these structures on the side. These are where the joints are, okay? It's actually called the articular pillar, and then these are the spinous processes that you can actually feel if you feel down your back, okay? And we use that for palpation when we're moving the joints and the bones to see if they're moving properly. I'm going to have we're going to zoom down to the low back here, and we're going to see that now we're in the lumbar spine, okay? The lumbar spine is consistent of 1, 2, 3, 4, 5 lumbar vertebrae, okay? I'm going to rotate the spine this way, and we can see that again, 1, 2, 3, 4, 5 lumbar vertebrae. Again, this is a really good shot of seeing those discs in between those bones, and again, we have a tough outer layer, and then we have a softer inner layer, and I like to think of it as like a jelly donut. And why is that important? Because when we get things like disc herniations, which this is representing a disc herniation, that jelly kind of gets pushed out to the side, and we can either have a bulge or we can even have a true herniation where the inside jelly material actually comes out. We can see why that's significant, especially in the low back, because a lot of times the most common area for the disc herniation is going to be posterior lateral or right here on the side, and that will irritate those nerves, and that causes a lot of pain, okay? So that's something to kind of keep in the back of our heads. We're going to work our way down in the back here. We can see, I want to show you the sacrum, okay? This is the big triangular bone, and then you can see the tailbone here, the coccyx, okay? This is all one structure. The coccyx is another bone. It's a bunch of vertebrae fused together normally within the normal average person, okay? We can see on the sides here the ilium, okay? This is the big ilium bone, or our big hip shin area where you feel, not shin, I'm sorry, just the hip area. You can feel it right here on the side. And then where the ilium and the sacrum connect is called your sacroiliac joint or your SI joint. That causes a lot of problems in people, so we always, as chiropractors, look at the SI joints as well, and there's one on each side. Actually, this landmark, these big knobs of bone here, actually, if you notice on people, the dimples in your back, that's where the SI joints are, okay? So it's a good landmark to use to know where, if you do have like low back pain, is it where that dimple is, and it's usually kind of consistent with SI joint pain, okay? I'm going to flip this over here and just show you a little bit of the anatomy of the ilium, okay? And we can see this huge big hole here. It's like a cup, okay? And that's where your femur sits. I'm going to show you on the skeleton, Mr. Bones here, what that is, okay? And if we kind of come over here on the hip, and we can see where that hip joint is, okay? The hip joint is consistent of that little cup area, and then that big ball of the femur here sits in that, okay? It's a very mobile joint. It's supposed to be a mobile joint, and it allows you to go forward and backwards, side to side, okay? It's like a ball in a socket, okay? I want to work my way down here to the knee, okay? The knee is very important. It's consistent of the femur connecting to the tibia here, okay? And a bunch of ligaments hold the knee together. A lot of times you hear the structures ACL or PCL, and that means anterior cruciate ligament or posterior cruciate ligament. Also, you can hear of ligaments called the LCL or the MCL, and those are ligaments that hold the bones together on the side, and that's called your lateral or medial collateral ligaments. Those are very common injured ligaments because those hold the bones together, and then the soft tissue like the quadriceps and the other muscles go over and move these joints forward and backwards, okay? You can see this big bone right here. This is that sesamoid bone or that big patellar, big patella or your kneecap, okay? And that sits within the tendon of the big quadriceps, and then that tendon inserts right here on the tibia, which is called your tibial tuberosity. A lot of times younger individuals have what we call Osgood Schlatters, and that's the irritation of this tibial tuberosity here on the tibia, okay? And we're going to work our way down to the foot here. I'm going to kind of lift it up, and let's see if he can go up there. We'll bring his foot up like this, okay? Here's the foot, okay? There's a lot of anatomy within the foot. We can see that the ankle mortise joint here is consistent of this bone right here, which is the talus, okay? And the talus articulates with the end of the tibia there, and that allows you to go forward, up in dorsiflexion, and plantar flexion down, dorsiflexion, plantar flexion, okay? We can see that big calcaneus bone right here. That's the heel bone, okay? A lot of times when we get plantar fasciitis or heel spurs, we get pain right here at the bottom of the foot, and that's where the anatomy kind of is there. There's a bunch of other bones here that I'm not going to really talk about in the foot. You have a bunch of cuneiforms, the cuboid, and then you have your metatarsals and phalanges. But there are a lot of structures within the foot, so you can irritate a lot of these if you twist them or step on them too much or injure them in that way, okay? I'm going to quickly zoom up to the hand area because I want to show you the hand and wrist because that's a very important area as well. The hand is, again, consistent of a lot of bones here within the wrist, okay? They're carpal bones, okay? We can see that there are 8 of them in there, okay? And if I turn it over, we can see that all 8 are articulating with each other, and they also articulate with these 2 bones here, your radius and your ulna, okay? If you kind of hold and kind of look straight down this way, you can see a little bit of a tunnel here, and that's actually where your carpal tunnel is, and your ligaments and your median nerve kind of sit in there with a blanket of tissue. We call it a reticulum over the top. And when this area becomes compressed or very stiff, that's when you get carpal tunnel like syndrome, like pain into the thumb or hands, okay? Again, we have a bunch of the metacarpals here and the phalanges, which are the fingers, okay? And that's pretty much the anatomy I'm going to show you, okay? And until next time here, me and Dr. Bones here, we're going to hang out and have some fun, okay? And until next time, remember, movement is everything, and movement is life.